Hello guys, today we are going to discuss about pharmacokinetics. As I already told in my previous video, what is pharmacokinetics? How our body react to drug. Okay, in this we will discuss about ADME. Pharmacokinetics is also known as the study of ADME, ADME. Okay, A for absorption, D for distribution, M for metabolism, E for excretion. Okay, so in this we will discuss how a drug will absorb in your body, how it will distribute in your body, how it will metabolize in your body, and how it is excrete out from your body. Okay, I hope it's clear for you now. So the first thing we are discussing here is about absorption. So let's discuss about permeation. What is permeation? Permeation is movement of drug into membrane. Okay, how a drug will move in the membrane or in the cell. Okay, now it is of two types, active and passive. This active is of two types, carrier and non-carrier. Okay, this carrier is from low concentration to high concentration, and in this it's by ATP. Here we use energy in the form of ATP. Okay, this non-carrier is by diffusion, okay, and this passive is from high concentration to low concentration. It's very normal. Normally any movement in this world is from high concentration to low concentration. Okay, now I want to tell you one more point. Majority of drugs follow passive diffusion. Okay, now let's discuss about some factors that affect permeation. Okay, there are majorly three factors. The first one is concentration gradient. Okay, as you all know how anything moves from in terms of concentration, from high concentration to low concentration. The second one is lipid solubility of drug. How much a drug is lipid soluble. And the third one is degree of ionization, that how much a drug can ionized. Okay, now there can be two types of drug. Okay, we can say there can be of two types of drugs. One is lipid soluble and the second one is non-lipid soluble, and we also call this non-lipid soluble as water soluble. Now ADME. Lipid soluble drugs are absorbed more. Their absorption is more, and when they are absorbed more in your body, then their distribution is also more. Okay, and when they will distribute more in your body, then obviously they will metabolize more, and when the absorption is high, then the excretion is low. Clear? Now this non-lipid soluble or water soluble drugs, their absorption is low, their distribution is low, their metabolism is low, and when their absorption is low, then excretion is high. That means their majority of part is excreted out from the body. These water soluble drugs. Okay, do you know why these things happen? As you know, where most of the drug is absorbed in your body, in intestine, from your intestine, small intestine to be very precise, small intestine. Okay, and it is made up of lipids. You know, we have lipid bilayer, that Singer and Nicholson model, fluid mosaic model you studied in your previous studies. There is one model called It is given by Singer and N.I. Nicholson, Nicol, Nicholson. You know, in this we have this lipid bilayers. This is hydrophilic head and this is hydrophobic tail. Hydrophobic tail, hydrophilic head. It's just kind of hot thing. High order thinking skill, but okay. So lipid soluble, it is made up of lipid bilayer. Then obviously the same thing will pass through them. So that same thing is lipid soluble drugs. Obviously those drugs which are lipid soluble, they can easily pass through them because they are lipid soluble. Okay, and non-lipid solubles cannot easily pass or cannot easily absorb, or they have less permeation. What is permeation? As we already discussed, it is the movement of drug into membrane. Okay, this thing is clear. Now let's discuss about degree of ionization. Degree of ionization. Okay. Non-ionized drugs are lipid soluble. Usually non-ionized drugs are lipid soluble. Okay. And water soluble drugs are ionized. Why? Because they have same properties. Lipid soluble drugs do not ionize. Okay, so non-ionized drugs pass easily through lipids. Okay, and water soluble drugs are ionized. Why? You know that because water is OH negative and H positive. Okay, what is the formula for water? H2O. So H positive and OH negative. So ionized drugs will form bonds. Ionized drugs will form bonds with water, and they are water soluble drugs, so they will absorb less in your body. Okay, so they will absorb less in your body. These non-lipid solubles are water soluble. Okay, now I want to tell you about something like acidic drug. Okay, these acidic drugs better absorb in acidic environment. Okay, now what are the examples of these drugs? The example is of acidic drugs is warfarin, ampicillin, barbiturates and aspirin. Okay, so acidic drugs are warfarin, ampicillin, barbiturates and aspirin. The mnemonic to remember this is warm bus. Okay, warm bus. Okay, these are acidic drugs. There are some basic drugs also like morphine, amphetamine. Okay, but they are not very important. You can just remember like morphine or amphetamine. These are basic drugs, but you don't need them. Means they are important drugs, but it is not important. Like, okay, so you can write it as HOTS. Like basic drugs are morphine and amphetamine. Okay, now what happens if someone have this acidic drug poisoning? Okay, so in acid poisoning, we do forced alkaline diuresis. Actually, what we do, we make our urine alkaline, not our, the patient make urine alkaline. Okay, in acidic poisoning or in the poisoning of these acidic drugs, we do forced alkaline diuresis, or we make our urine alkaline. We make the patient's urine alkaline. Okay, now I want to tell you something about this urine thing. Make urine acidic and alkaline or basic. Okay, how we can make our urine alkaline is by ascorbic acid. We can give the patient ascorbic acid and ammonium chloride. NH4Cl, ammonium chloride. How we can make the urine of the patient alkaline? We can give sodium bicarbonate, NaHCO3, sodium bicarbonate, and we can also give acetozolamide. Okay. Now, I want to tell you about one equation that is you already studied in your lower classes, that is Henderson-Hasselbalch equation. Henderson-Hasselbalch equation. Okay, as per what is this equation? This equation is like pH is equal to pKa plus log of ionized, like how much the drug is ionized, and non-ionized. Okay, what is this pKa? This pKa is pH of the drug, pH when drug is 50% lipid soluble or non-ionized and 50% water soluble. Water soluble means ionized. Okay, we can also write this in different term, like when the drug 50% cross the membrane and 50% don't cross the membrane. Okay, so this is the equation of Henderson-Hasselbalch equation. pH is equal to pKa plus log of ionized upon non-ionized. Okay, so as per this equation, acidic drug mainly absorb in stomach. Acidic drug mainly absorb in stomach because in stomach we have acidic medium because of HCl, you know. So acidic drug mainly absorb in stomach and basic drug mainly absorb from, this is F, from intestine. Okay, as per this equation, as per this Henderson-Hasselbalch equation, acidic drug mainly absorb in stomach because of the same pH, you know, acidic drug and same medium, to be very precise. In stomach we have acidic medium because of HCl, hydrochloric acid. Okay, so acidic drug mainly absorb in stomach and basic drugs mainly absorb from intestine. Okay, but I want to tell you one thing. This is only correct as per this equation, Hasselbalch. Okay, Henderson-Hasselbalch equation. Usually, as I already told you, most of the drug, or you can say 80% of the drugs are absorbed, even they are acidic or basic, practically. Okay, this thing which I just taught you is as per this equation. Okay, but practically 80% of the drug is absorbed from small intestine. Got it? Because, you know, in our stomach the food don't stay for a long time. Okay, in our stomach the food doesn't stay for a long time, like approx after 30 minutes your stomach gets empty. Okay, the stomach, that food will go into your small intestine and there it absorbs. Okay, so it will get less time. And the second thing is, in stomach we have less surface area. So if there is less surface area, that means there is less absorption. Okay, as you study, like in our small intestine we have like folds like this, we call them villi. In a small intestine we have folds, we call them villi. Why these villi are present? To increase the surface area so that things get absorbed. Okay, so in stomach we get less time and less surface area to absorb anything, to absorb. Okay, but if anyone asks you question about as per this equation, so as per this equation, acidic drugs absorb in stomach and basic drugs absorb in intestine. But practically, in your practical life, all drugs absorb, 80% drugs absorb from your intestine. Okay, small intestine. Okay, I hope this thing is clear. Now, like some of you may ask, like why we are discussing about these things like acidic drug, basic drug, morphine and amphetamine. Okay, what is the need for this? Now, I want to tell you the need. Before that need, I want to tell you one more point about them. Acidic drug will bind to albumin. Okay, it is the most abundant protein in your blood. In your blood is albumin. Basic drug bind to alpha-1 acid glycoprotein. Okay, so acidic drug will bind to albumin in your body, and these basic drugs bind to glycoprotein, and to be very specific, alpha-1 acid glycoprotein. Okay, and this is not 100% thing. It is usually. There are some exceptions obviously, but you won't need them. So acidic drug bind to albumin and basic drug bind to alpha-1 acid glycoprotein. Now let's come back to the point why we need to study about this thing. Okay, so as you know, in nephrotic there are two types of kidney disorders. You will study about them in pathology, nephritic and nephrotic. I'm just telling you, like in nephrotic syndrome, what is this nephrotic syndrome? In this nephrotic syndrome, what happens? In your urine, you will find more than 3.5 millimole per liter protein. Okay, whenever there is protein in the urine of a person and it is more than 3.5 millimole per liter, then it's nephrotic syndrome. Okay, you will discuss about the difference between nephrotic and nephritic in pathology. I am just here to tell you about this thing. Okay, so in this case, the proteins decrease in your body. Okay, so when the proteins will decrease in your body, then we can call it as hypoalbuminemia. Hypo means less, albumin means albumin. Okay, hypoalbuminemia. Okay, so in these cases, so we give low dose of acidic drug. I hope you get the practical importance of this thing, acidic and basic drugs. Okay, like in nephrotic syndrome or like in liver disorders. You know, in liver disorders we also got this hypoalbuminemia. You know, this albumin and all of the proteins are formed in the liver. Okay, so if there is any liver disorder like cirrhosis, many disorders, okay, if there is any liver disorder, then also we will have this hypoalbuminemia. So whenever a person is suffering from nephrotic syndrome or hypoalbuminemia, in those cases we will give low dose of acidic drug. Why? Because that person have less albumin. Okay, when there is less albumin, so there is less protein is present in the person to bind with that acidic drug. Okay, I hope this thing is clear to you. And make urine acidic and alkaline is also very important in your practical life. It's very important. Okay, when you will become a doctor, how you can make urine acidic or alkaline. Okay, by sodium bicarbonate and ammonium chloride, ascorbic acid, acetazolamide. Okay, this is also very important, like in those acidosis and alkalosis disorders, and this thing, passive diffusion. I hope everything is clear about pharmacokinetics and what I taught you till here. Okay.